Welcome to the PALS Primary Assessment Review. This is a hands-on systematic evaluation. After the initial assessment, checking appearance, breathing, and circulation. If there is no life-threatening problem, we move immediately to the primary assessment. We follow the ABCDE model: airway, breathing, circulation, disability, and exposure. First is airway. Determine if the airway is open and patent. If it is obstructed, you must open and maintain it. This may require simple measures like positioning or advanced interventions. For a responsive child, allow him to assume a position of comfort or by elevating the head of the bed. For an unresponsive child, position him supine. Open the airway using a head tilt chin lift or a jaw thrust if trauma is suspected. Finally, ensure the airway is clear. Suction immediately if there are visible secretions blocking the path. Next is breathing. We assess the respiratory rate, pattern, work of breathing, and oxygen saturation. Review the normal respiratory rates for the child's age group. However, remember this rule: a rate of less than 10 or more than 60 is always abnormal in a child of any age. Look for tachypnea, slow respiratory rate, or apnea. Assess for increased respiratory effort. Look for nasal flaring, retractions, head bobbing, or seesaw breathing. Note where the retractions are occurring to gauge severity. Also, look for inadequate effort. A weak cry, slow rate, or agonal gasps are ominous signs. Listen to the lung and airway sounds. Are you hearing stridor, snoring, wheezing, or crackles? Is there a barking cough? Identify signs of severe respiratory distress or failure. Watch for poor air movement, cyanosis despite oxygen, or a silent chest, which indicates a lack of airflow. Moving to circulation. Assess heart rate, pulses, capillary refill, skin temperature, and blood pressure. Check the heart rate against age-based norms. A rate over 180 in infants or 160 in children warrants immediate investigation. Palpate pulses. Both central pulses, like the femoral, and peripheral pulses, like the radial. Check capillary refill. It should be 2 seconds or less. Look for pallor, mottling, or cyanosis. Though remember, for cyanosis to occur at least 5 grams per deciliter of hemoglobin should be desaturated. Assess blood pressure. Look for hypotension. Remember, a child can lose 20% of their blood volume without showing hypotension. Low blood pressure is a late sign of shock. Finally, track urine output to assess end organ perfusion. Next is disability. We need a rapid neurological assessment. It includes the AVPU scale, GCS, pupillary response, and blood glucose level. Use the Glasgow Coma Scale, GCS, for a detailed score, assessing eye opening, motor response, and verbal response. Or, use the Rapid AVPU scale, alert, verbal, pain, or unresponsive. Check the pupils, size, shape, and reaction to light. They should be equal, round, and reactive to light. Don't forget blood glucose. Hypoglycemia can mimic severe neurological injury. Finally, E is for exposure. Undress the child to perform a physical exam. Look for trauma, bleeding, burns, or rashes. Now, identify the problem. Is it a respiratory issue? Classify it as distress or failure. Determine if it is an upper or lower airway obstruction, lung tissue disease, or disordered control. Is it a cardiovascular issue? Is the shock compensated or hypotensive? Identify if it is hypovolemic, distributive, cardiogenic, or obstructive. Proceed to the secondary assessment. Use the sample mnemonic to gather history, signs, symptoms, allergies, medications, past history, last meal, and events leading to illness. Perform a focused physical exam based on the severity of the injury. Critical care requires ongoing reassessment. Continuously reapply the primary assessment to track the effectiveness of your interventions. Finally, order diagnostic assessments based on the clinical picture. This includes blood gases, lactate, hemoglobin, chest X-rays, and echocardiograms. Use the Evaluate, Identify, Intervene sequence when caring for a seriously ill or injured child. From the information gathered during your evaluation, identify the child's clinical condition and intervene with appropriate actions. This helps you determine the best treatment or intervention at any point. This process is ongoing and continued until the child is stable. Remember, systematic approach saves lives. Thank you for watching. Please like, subscribe, and share for more critical care related videos.